So, good morning, Sir Lim. My name is Justin C. Custodio, and I'll be now performing the virtual return demonstration for the assisting the patient from bed to wheelchair. For the definition, assisting a patient from bed to wheelchair is a safe, clinical, and caregiver-guided transfer technique involving pivoting designed to move a patient from a lying to seated position, then into a wheelchair. For the objective, first is this increased mobility. Second is safely move the patient to a new position. And lastly is to reduce the risk of complication from prolonged immobility. For the safe and security measure, first is ensure the wheels are locked before performing the procedure. Second is assess the patient's strong and weak side. Observe a proper body mechanics. For the pre-procedural preparation, first is wash hands or perform a medical hand wash. Introduce yourself to the client, identify the client's identity, explain what you're going to do, and how the clients can cooperate. Next is gather the necessary equipment such as your wheelchair and your waist belt or gait belt. And next is provide privacy and observe proper body mechanics. First is check the client's chart if there is a physician's order to transfer the client from bed to wheelchair, and check for any restriction that may influence the client's ability to move or to be repositioned. Check for the tube, IV lines, incision, or any equipment attached to the client to avoid any accidental removal. So, maayong buntag, ma'am. Ako din si Justin C. Custodio from Bukidnon State University, and I'll be your student nurse from 8 a.m. to 4 p.m. So, pwede ba na ako mas inong ni ma'am?
Hindi ko taas, sir.
Okay, Ma'am Wendy. Kami mo kanhay. Identity band. Okay, so, Ma'am Wendy, ka nang mag-perform day ko sa imo o transferring from your bed sa itong wheelchair, ma'am, as prescribed by the doc na ako kang ipupakon kanya pa-request siya o CT scan ni ma'am. Okay ba, ma'am?
Yes, sir.
Okay, so, ani ka ng weakness side na or kaya sa kusgan, ma'am? Kusgan na ba ito ang side doc ang side mas ng kamot?
Yes, sir.
How about sa tintil matabay siya? Kular matanag kuya, ma'am?
Yes, sir.
Na maka-cooperate ka, ma'am, by na following sa instruction later on, ma'am, kaya para ma-reduce na to ang risk of any kanang injuries, ma'am. Tapos na ba kayo mga pangutana, ma'am, or kanang clarification? Next is always predetermine the number of staff required to safely transfer a patient horizontally. So as for in my case, my patients are kanang capable rapod sa ako ang size. So whether rapod ako lang mag-assist sa patient. Next is, if needed, move the furniture and equipment to make room for the wheelchair. Then place the bed to a lowest position and raise the headrails of the bed as high as the patient can tolerate. So assuming that I've already lowered the bed, and I will now raise the head of the bed to as much as the patient can tolerate. Yes, ma'am.
Dili ka, sir.
Ano, okay na ba, ma'am? Or tataasan pa?
Sige pa, sir.
Ano, ma'am?
Okay na, sir.
Next is place the bed to a lowest position and raise the top. So as you can see, ako na na-raise ang yung head of the bed to as high as the patient can tolerate. Then ensure that the bed brakes and wheelchair brakes are applied. Put the wheelchair right next to the bed at a 45-degree angle facing the foot of the bed, and assist for the patient weakness on one side, place the wheelchair on the strong side. So, kanang asa dilapit ato ang kanang medyo luya, ma'am.
Sa left, sir.
So, assume that I have already lower the bed brakes. I will now lower wheelchair brakes. Then, assist the patient to a sitting position as prescribed in assisting client to a sitting position. Once the patient has seated at the side of the bed, stand in front of the patient and assess for ability to balance and complaints for dizziness. Allow legs to dangle a few minutes before continuing. So, ano kung ipaside lang na kayo? Ready na para mag-input mo. Ipaside. Okay. Mag-yan po ba na ma'am? 3, count of 3 ma'am. Mag-timpang ko ay paside sa position. 1, 1, 2, 3. There, baka na. Wala ka nalipong during sa atong pag-sitting na. So, as the clients, assuming that the clients already dangled her feet few minutes ago, assist the patient to put on a robe or non-skid footwear. So, assuming that we have already put the a non-skid or a robe on the client, let us now proceed. Apply the gait belt snugly around the waist if required, only if it is required or if required for the patient. Check to be certain that the belt is securely fastened and place the hands on the waist to assist into a standing position. Then, as the patient leans forward, grasp the gait belt if required on the side of the patient. Let the patient hold your side with your arms outside the patient arms. Position your legs on the outside of the patient legs and the patient's feet should be flat on the floor. So ma'am, magbutang na po sa ato ang gait belt ma'am no, para dili kay ka mag-listen. There, porque paliyog ko ma'am, bunit lang tatingin sa pang waist ma'am para hindi ka ma 1, 2, 3. So on the on the count of 3 and using a rocking motion, help the patient stand by shifting your weight on the back foot. So next is once standing, have the patient take a step back until they can feel the wheelchair on the back of their legs. Have patient grasp the arm of the wheelchair and lean forward slightly. Palihog ko gunit sa ito. Magpataro ka na. Next is, as the client or the patient sit down, shift your weight from back to front with bent knees, with trunk straight and elbows slightly bent. Ask the patient to use her arms to steady herself on the wheelchair and allow the patient to sit in a wheelchair slowly using an armrest for support. Flex your knees and lower the clients on the wheelchair. So mo to siya kung gibuhat ganiya, and as the clients are now on the wheelchair, make the patient comfortable. Assess the patient for alignment in the wheelchair, cover with blanket if needed. Then perform a hand hygiene and document the findings and the client's activity. So, Ma'am, okay ba comfortable ito ba, ma'am?
Yes.
Or need ni mo og blanket mo?
Dili na sir.
So that perform my hand hygiene. That's all, sir.